Hospitals so crowded with COVID patients, people receive IV medication from their cars. A crisis brought on by the end of lockdowns just as the virus was spreading in a community with weak immunity. Officially, China has reported around 2,000 daily COVID-19 infections over the past couple of days, but those numbers represent a fraction of cases. China's lack of primary health care means people crowd hospitals where the people treating them may be sick.
Throughout China, people who are infected, those medical doctors already being tested positive, they are still required to work in the medical setting.
China uses a locally produced COVID vaccine, requiring additional boosters.
So the question, I think, and the challenge that China and other countries still have is, are the people that need to be vaccinated adequately vaccinated with the right vaccine and the right number of doses? And when was the last time those people had a vaccine?
China today announced plans to increase vaccinations for the elderly and most vulnerable. And while it's rejected offers of American help, it does have a supply of Pfizer's Paxlovid to treat severe COVID cases.
It does seem like the trajectory is to, let it rip and sort of deal with the consequences.
People seem to be taking their own precautions.
COVID policy in the wake of nationwide protests against the restrictions. Authorities are trying to persuade reluctant seniors and others at risk to get vaccinated to prevent large-scale outbreaks, hospitalizations, and deaths. Those already showing symptoms make their way to temporary clinics set up around the city, like this public gymnasium where they can get medical advice and treatment. But scores of workers are also coming down with the virus. Online classes as cases soar. Nurseries and childcare centers are also set to close across the country.
About going out, traveling and enjoying life. Many popular places are already full and it's difficult to make reservations. Life is returning to pre-pandemic levels.
The freedoms have come at a price. The official death toll remains low at a little more than 5,200, but experts believe the real figure is many times higher, and that China may be facing its worst surge yet in the build-up to the winter travel season and Lunar New Year, when hundreds of millions of workers will travel home by road, rail.
He said he's been waiting here for hours, and he still has no idea if his friend's body can even get cremated today.
And it's not just in Beijing. Social media shows crematoriums and funeral homes around the country overwhelmed. In this funeral home in Jinan, the man is saying it's going insane. Here it is packed with cars, and vans carrying bodies stretch all the way into the distance in front of this crematorium in Shijiazhuang, and families wait and stand in their mourning clothes at this Wuhan funeral home, with no idea how long they have to wait before their beloved ones can be cremated. Increase vaccinations. Long lines like these are forming across the country outside of hospitals. In Hangzhou, people wait for hours outside in the cold rain. Crowds form outside of hospitals in Wuhan, ground zero of the original outbreak.
This is a COVID den outside for his elderly family member who he said is very sick with a high fever from COVID, but he said this